Welcome to Homelessness and Mental Illness, Building a Home for Recovery. It is a program to enhance your ability to enter data into the ROSI system. My name is Rita McElhaney, and I'm the Community Development Manager for the Missouri Department of Mental Health. And I'm delighted to be with you today and to discuss this topic that's so near and dear to my heart. Before I came to the Department of Mental Health, I worked for the Department of Health and Senior Services, and I was a program manager for a HUD program for individuals living with HIV and AIDS. So I'm pretty familiar with some of the challenges in making sure that we get data correct in the HUD system. But I also want to let you know that the data that you're putting in is really important. When other agencies or state departments want to apply for funding, they rely on the data that HUD provides us regarding housing issues and the people that we serve. So even though it feels like you're just putting a little, clicking on a dot, you're contributing to the data system that's so important for all of us so we get a better picture of homelessness. So thank you for that. I want to thank Lindsay at MASW with the HMIS program for inviting me. So what are we going to do today? Well, we're going to talk about the assessment that you have to go through, and we're going to talk about interventions that you may need to provide based on what you find in the assessment. And part of what we want to do is we want to make sure you understand about the relationship between homelessness and mental health. And we want to make sure that you have the information you need to connect your clients to the appropriate resources that are available in your community. So part of what we're going to do in the assessment portion is we're going to talk about what is mental illness. We're going to talk about some statistics. They're really important. And we're going to talk about the questions that you're going to have to answer as you go through that, through the ROSI screens. So what is a mental health issue? Well, I just want to make sure you understand that mental health is kind of a range from perfectly healthy mentally to mental illness. And people often move along that continuum, moving back and forth. And only when people reach a certain threshold of disruption in their mental health can they be diagnosed with mental illness. And that happens when the illness affects a person's thinking, their emotional state, and their behavior. And more importantly for us today, it disrupts the person's ability to carry out daily activities. And so mental illness can be an underlying cause for homelessness. Also about mental illnesses, it has to last, that disruption, there can be a short-term severe disruption, but it has to last a certain amount of time for us to really call it a mental illness. So what are some of the risk factors for developing a mental illness? Well, one of them would be inherent in having experienced homelessness. That's exposure to stressful life events and ongoing stress and anxiety. So if someone has an underlying tendency to develop a mental illness, maybe genetically or through their biochemistry, homelessness can be a trigger for mental illness. So I want you to be aware of that. It is so traumatic to be without a place to live. And that trauma can last for a long time, even when they're in your program where they're beginning to get stabilized. There is a genetic link to most mental illnesses. And what that means is simply that because it's in your genes, I don't want you to assume that a person has some mental illness in their family, that it means they will have mental illness. But we do know that for certain disorders, there is a genetic factor where it might be described that maybe schizophrenia might run in families. But the biochemistry is an important thing to keep in mind because not everybody is the same. They may have that same genetic tendency for mental illness, but there are other factors that can trigger it. They've done some twin studies, and there's been, in these studies, one identical twin would develop a serious mental illness and the other wouldn't. So we'd ask what caused that change. And sometimes it's their biochemistry. Sometimes it's their level of stress and their resilience to stress. And one of the big things to keep in mind is substance use and substance abuse, which is a tendency to engage in if you're trying to self-treat the mental illness or the symptoms that are so distressful. The substance use, not only can it help them feel better in the short term, but it can contribute to worsening of mental illness. The other thing we wanted you to know, and I think it's really important because you're going to be one of the links to the outside world, is that just having a mental illness is a serious health risk. We know that the normal lifespan for a person in the United States is somewhere around 80. But for many people who have serious mental illness and lifelong symptoms of mental illness, statistically they could die 25 years earlier. And so that means a person with mental illness who without mental illness might be expected to live into their 80s may die in their 50s, which is really sad. And when people hear that statistic, they kind of chalk it up to suicide. But what's really true is just the difficulty of living with mental illness can cause those things that everybody has to happen earlier. People with mental illnesses tend to exercise less, smoke more, and have more day-to-day stress. And so thinking about how you structure your housing program, getting people up and moving and providing opportunities to do things other than smoke and dealing with stress are really parts of how people can get better from mental illness. The other thing I want you to be really aware of is the risk of suicide. Being homeless is a very high risk factor for suicide. There's been a lot of studies studying the link between that, and it's found that 22% of homeless people in one study had attempted suicide at some time during their life. And more than that, 61% of those who were homeless had reported thinking about suicide. That their situation had been so stressful for them that suicide was something that occurred to them. The other thing, it's a really high risk for homeless youth, particularly those who have experienced trauma. And those of you that work with youth know that sometimes it's the trauma from their family of origin that takes them to the street, but they also experience a great deal of trauma when living on the street. So there's an enormous challenge in getting kids or youth housed. 46% of homeless in one study had attempted suicide at some point in their life. That's a pretty scary statistic. And so we want you to know that you need to be kind of alert to that risk, and that as you help people stabilize in housing, you're really part of that effort to reduce that risk, because when people are stably housed, that risk goes down, and when youth are kind of out of the street, away from those harmful experiences of the street, they also have a chance of doing better. So being alert, particularly when they're new, to suicide risk is pretty important. About the people that you're dealing with in general, an estimated 39% of people who are homeless have some type of mental health issue. And so that's a pretty high statistic. The general public, it's closer to 20%, but among homeless it's as high as 39. And when you narrow it down to veterans and things like that, it can be that statistic can be a lot higher. Of those 39% of the people who are homeless who have some type of mental health issue, 20 to 25% of them have a serious mental illness. So again, in the general public, serious mental illness among adults tends to be around 7%. With the homeless, it's around 25%. And then the thing that's so worrisome, and the thing that I'm hoping that as housing providers as you work through your ROSI process, I'm hoping you're going to help us make a difference in this last statistic, because only 47% of people with a mental health problem or a mental illness ever seek treatment. And so that's a pretty important statistic, and you actually have an influence on that, because we think that you might be able to help people get linked up with treatment. When we talk about these kind of gloomy statistics, and we talk about the fact that the people that you deal with, probably a higher percentage of them have a mental illness, gets kind of gloomy, but the takeaway message today that I want you to have is that recovery happens. People recover from mental illnesses. And we're going to talk a little bit about what contributes to that. And I want to, first of all, just kind of explain what we mean when we say recovery. For some people, it's a complete remission. They'll have 1 or 2 episodes of a serious mental illness and never have them again. And that can happen even with the most serious mental illnesses like schizophrenia and bipolar disorder. There could be 1 episode and no recurrence. But for many people with a serious mental illness, it's really kind of how do you build a life when you may have symptoms once in a while. And if you can build a life where you're maintaining yourself in your housing, you have a job, you have a circle of friends, you have meaning in your life, that's recovery. And some people, unfortunately, really battle it all their lives. But amongst people with serious mental illness, they can be along that continuum. And so I would hope you, when you're interacting with someone who has a mental illness, that you'd be able to share in the optimism that we feel that people can recover. But how do they do that? Well, for one thing, people who get help for their mental illness early in the disease process have a better chance of recovery. And what I mean by that is that if we can get people plugged into medical care and counseling and the other supports that are available, then we know that if they're in treatment, if they have another episode of mental illness, the tendency, and this is not always true, the tendency is that the episodes are less frequent and they could be less severe. So we know that not having to deal with the disorder and the symptoms all the time gives people a chance to look at how can they reach recovery. So we want you to know that as you help people find the help they need, you help build the network of support around them, and that does include professionals as well as non-professionals, then people have a chance of recovery. So keep that in mind. So let's talk about what we're going to do with ROSI specifically. We're going to talk about these screening questions. We're going to talk about why we're asking them, and really why we're asking them is because we have to get a snapshot of where people are in terms of coming in. The statistics that I gave you, they came from research that's been done, and so again, as I said, the data that you put in there is really important to HUD. That enables them to go to Congress and say, here's what we need, because here are the people that are homeless. So always remember that doing this and doing it well is really important. One of the challenges around the questions around mental health and mental illness is there's a lot of resistance to talking about that. And so we want to talk about where did that resistance come from, and then we want to make sure you understand that we have to kind of sort out whether the distress they may be feeling or expressing when they come in, can we distinguish that from a mental health problem or a mental illness? So we want to do that. So again, we've got these key screening questions because we're going to ask them if they have a mental illness, and we're going to ask them if any of their family members have a mental illness. And what I want to talk a little bit about is stigma. I want to talk about the fact that mental illness is one of the most stigmatized diseases around. And what that means is that people have a lot of attitudes that make them uncomfortable with someone who has a mental illness. And so it's very difficult to get somebody that you haven't built a relationship of trust with to talk to you about mental health problems. And so we want to make sure that there's an environment in your housing program where people feel safe to talk about it. And we do that in a number of ways. You, as a person who's engaging and talking with the client about housing and filling in these forms, has one part. But I want to talk a little bit about the environment of your housing program itself and how it can lead to either an unwillingness to disclose a mental illness, or it can contribute to a positive experience for someone with a mental illness. And when I talk about the environment, it's kind of, we do kind of a little check. How do we talk about mental illness in front of people? Because as you know, statistically, if you're in a crowded room, a number of people in that room either have or have had a mental illness. So it's important to keep in mind that the person who hears you talking, you really don't know whether or not they have a mental illness. And so when we use words like crazy or lunatic, or we use disparaging words or mocking words about a mental illness, the person in that room that hears that makes a mental note. I can't trust that person. That's not safe to talk to that person. So it's really important that we check our language and make sure that nothing is being said that might discourage someone from disclosing. And so, and another thing that I would like to ask you to do is think about how you talk about individuals who have a mental illness. And in the mental health community, in the disability community, we talk about it as we talk about people first language. And so I'm going to describe someone two different ways, and I want you to think about how does that sound. If I say Jane is a schizophrenic, and then I say Jane is a person who lives with schizophrenia, can you hear the difference? In the first phrase, I'm saying Jane is her disease, and that's really the most important thing about Jane. When we say Jane's a schizophrenic, that's all we're noticing is her disease. But when we describe Jane as a person with schizophrenia, then Jane has when we think about Jane, we think she has many characteristics and many qualities. She may be a great mom, she may be a great employee, she may be a great daughter, she may be a great friend, and she may have schizophrenia. So I will ask you to use that people first language, that people are not their disease. They may have a disease, just as like we don't say there's a cancer, Jane's a cancer. We say Jane is a person with cancer. So just keep that in mind, and I hope you'll think about that. The other thing we want to kind of talk about is how do we sort out whether or not the distress they may be feeling upon entering the shelter can be distinguished from a mental illness. And what the answer to that is, we can't. And we have to really rely on their report. Even if we see things that we think might indicate that someone has a mental illness, unless they've told us they have a mental illness, or we use some of the other questions to determine whether or not they have a mental illness, we really can't click on that they have a mental illness. And a little bit of a problem with that, because there's one side and there's one symptom of mental illnesses that not everybody has, but some people really don't know they have it. And so it's pretty darn hard to get at the answer to that question. So what I'm going to encourage you to do with the Rosie questions is ask them out of order, because we can get some information by asking the other questions, and they can help make it easier for us to ask the question. But we'll talk about that in a minute. First, so what I'd like to do now is I would like to talk about, we talked about how do we get an environment in your housing program where people feel respected and they're not identifying people that they can't trust because of their language. So let's just say you've got somebody in front of you and you think you've got this respectful relationship, but you're going to embark on something kind of tough. You're going to ask some tough personal questions. And so here's what I want you to do. before you start, I want you to clear your head. I want you to remember that a mental illness is an illness and that people are not having symptoms deliberately. I want you to remember a statistic. If fear about violence comes up, I want you to remember this statistic, that people with mental illnesses are 7 times more likely to be a victim of violence than a perpetrator. And so the person in front of you, if they have a mental illness, even if they appear psychotic, they're not necessarily violent. And so don't assume they are. And the rare times when there is someone who is psychotic and has psychotic symptoms and has been violent, almost all of the time they've either not been in any treatment whatsoever or they've been using some substances. So just keep that in mind. So it's really important to check your fears and your prejudice and your opinions and center yourself, and then find that place in you where you are calm. So if you take deep breaths, it helps you kind of clear your mind and be present for the person in front of you. One of the things that, and this is going to be a tip that's good for anybody who's under any stress, is to talk in a clear, concise way. And by that I mean use short sentences. It's important not to have a sentence that's loaded with a lot of information, because if somebody has a lot of stress going on, they also have a lot of racing thoughts going on, and it's really hard to take in a lot of information. So if you use a short sentence, and one of my tips is if it has a comma in it, it's too long. Try to phrase your sentences and questions very short so people have time to kind of process what it is you're asking. People tend to mimic the person that they're with. And so if you have a quiet voice and you speak in a moderate pace, it's going to help calm down the whole environment that you're working in. So you've asked short questions and your voice is quiet and it's moderate, but it's really important for you to find some time after you ask a question. Don't assume the person doesn't understand you. Give them time to process the question and form their answer. So if you're getting through that stress and that kind of brain chatter that's going on, sometimes it takes a little while to say, here's the question, I heard the question, what does that mean? Okay, I know what that means, here's the answer, now I'll say the answer. So allow time for that to happen. And if you're sitting and silent, but you have a neutral expression on your face, and your face is calm, and you're not, furrowing your brows or, looking impatient, people will start talking to you. Silence is golden. So use silence. It really helps open up, it really helps open people up. And it also communicates, I respect you enough to wait to hear your answer. I'm not going to, assume you don't know it. So one of the questions you might ask, instead of first, do you or someone in the family have a mental illness, you can ask if they're on medications. And so if you're asking if they're on medications, that can help you kind of get to whether or not someone has a mental illness. Now, it's important to remember that people with mental illnesses don't all take medication. Many of them choose not to. Many of them don't need them. So it's not a foolproof way of getting at whether or not there's a mental illness. But you can ask that question and listen for the answer and see what that answer tells you. And so I'm going to tell you some medications that you could be looking for, that if they tell you that they're on this medication or they have been on the medication, and do keep in mind, if you're asking, are you on medication, they may be thinking your question is, did they take their pills this morning? And they're going to answer no, but they may answer no because they don't have any, and they may need some help getting their medication. So keep in mind that question kind of can be interpreted a couple of different ways. So you might ask, are you on medication, or have you ever been on medications? And what were you on, and why don't you have them now? That kind of thing. Because that's a link that you might be able to link somebody up to get the services that they need. But I'm going to tell you some medications that I think if they tell you they've been on them, it's going to be a good indication that they have been diagnosed with a mental illness. And if those are listed, you can click mental illness on that part of the screen. So some of the medications that someone might be on are Thorazine or Haldol or Perfenazine or Flufenazine or Clozaril or Risperdal, Zyprexa, Aeroquel, Geodon, Invega, and Abilify. But sometimes Abilify is offered to someone with depression, and it's probably an indication that they've had a serious mental illness that hasn't responded to other depression medications. But that I would be hesitant to assume that means that they have a serious mental illness. There's a number of medications like Prozac and some of the Lexapro that are given for depression, and they can't be used as an indicator that there's a mental illness because they're also used for less serious cases of depression. So that's not going to give you that clue. But if any of those medications, and I think they're going to be in your slideshow when you get a copy of it, if you request a copy of it, if any of them are listed as medications they've taken, then that indicates they or their family members have been diagnosed at one time with a serious mental illness. So that's a good question to kind of sort through. Can I click mental illness based on the medication? Another question is, are they receiving services? And so again, that's another thing. Are you or have you ever received services? Now the question is, are you receiving services? So you're going to answer the question. But if you ask it in that way, it can help you get at whether or not they've been involved in the mental health system in the past. And to get into the mental health system, you pretty much have to have a serious mental illness. And so that is another indicator that you could click on mental illness. One thing you ask is, have they ever received counseling, and where did they get counseling? Or have they been involved in a community program? Have they gone to NAMI for support groups? Now, they may have gone to NAMI because they're a family member, but you can ask those questions. But the important thing is, if they're going to the community mental health center or a community mental health center, then they have been diagnosed with a serious mental illness. And by engaged with the community mental health center, by that I mean, do they have those, they may have gone for one time for an assessment, and certainly that's not going to be an indicator. But if they've been enrolled in a program there, that means that they've had a mental illness or their family members had a mental illness. So the other thing is, we're going to ask if it's disabling. And we can ask this question too early, and we can say, have you ever been told that you were disabled due to a mental, physical, or emotional impairment? And so by asking that question, they may, hopefully you're starting to build some trust and you're going to get an answer. But what you can ask is, do you have any income? And if they have income from SSDI, and that D stands for disability, or SSI, which is the state program for adults that are disabled, if they're getting income from there, they have some disability from their illness. And if they haven't indicated that they have it because, they had severe asthma, or they've got, some other thing that prevents them from working, that it's pretty possible that they have the disability from a severe mental illness. That is the most common cause for eligibility for disability. So if they're, what's disabling mean? It's of a long, continued, indefinite duration. Remember, people have, an episode of depression, but if they've had recurrent depression all their life, then we know we've got a serious mental illness. It substantially impedes an individual's ability to live independently. They've, had some episodes where they have failed and they've had to go back in the hospital and those types of things. They're going to be indicators of serious mental illness. But on the reverse side, if it's disabling, stable housing could improve the ability of the client to maintain engagement in healthcare and community life. So that's important. Your linkage to housing, in spite of someone's disability, could mean they can get back into the life they left behind when the illness emerged. So keeping that in mind is pretty important. And then you can sometimes come at whether or not there's a mental health problem, and they can test your response to that. If you ask the question, has anyone in your household had a mental health problem? And just another little caveat, sometimes when people are talking about their children, some parents will freely admit that their child has a mental health problem because they know that it's made it possible for them to get help with their kids. But again, that stigma and shame sometimes comes up with parents, and they don't want to admit their kid is having a problem. So it's it's one way that you may get at the mental health problem. And remember, silence is here. People will start volunteering things if you've built that environment of trust. So eventually, maybe if someone says, yeah, my daughter has had some problems, mental health problems, and we had her in the hospital for that. So you've gotten there, and you can just remember that silence can help people begin to share. But what you want to do when we finally get to this question about mental illness is you want to remind them that services are available if they need them, and that we're going to spend a minute figuring out where the services are in your community, and you'll give them a referral if they ask for it. So next part is intervention. So they've disclosed that there's a mental health problem or a mental illness in their family or within themselves. And so we want to talk about, what do we do with that? So if someone says no, that there is no mental health problem, here's another opportunity to make sure that you're creating an environment of trust. Because even if they're saying no now, you're building the relationship for later when they may find that they want to say yes to you later. And so it's important to watch your face. So if somebody says no, it's important to make sure that your face is not registering relief, okay? Think about what, if I told you that I did not have a mental illness, but you weren't sure, and if I said no, and you looked relieved because you wouldn't have to, concern yourself with referrals or having someone in your housing program that has a mental health problem, that's telling me that you're not a person that I would come back to if I wanted to disclose later. So watch your face, and be sure and tell them, if you ever do need help, I'm happy to identify a resource for you. If they say yes, then don't look scared. You want to thank them. If they tell you if they tell you, yes, there's mental illness in my household, it's really important to honor that. They've indicated that they trust you enough to tell you that thing that can be very secret. And so you want to thank them for it. And you want to encourage them that, they don't have to be in counseling, or they don't have to be in mental health program to live in this housing program. But we want to make sure that you know that if you need help, we'll be happy to link you up. And so, again, watch your face. You don't want to look scared about it. You don't want to look upset about it in any way. Again, we have a neutral face because we're not reacting to that. We're not showing that they've dropped a bombshell in our lap, and we're thanking them for telling us. The referral part is pretty important, and the good news, and I'm afraid I don't have the best screenshots for you, but the good news that for people who have a serious mental illness and for people who have maybe less serious mental health problems, and for family members of people with mental health problems, there is support. And so I want you to keep in mind that the Department of Mental Health website is where you would turn for a lot of information about resources in your community. And then for less serious mental illnesses and for support for people with for people who have family members that are mentally ill, then there's organizations like NAMI and Mental Health America and 12-step programs. There's 12-step programs for people with substance abuse, with addiction, with mental illness, and then there's 12-step groups for people that have both mental illness and substance abuse problems, which happens very common, by the way. So we want you to be comfortable and maybe bookmark the Department of Mental Health's web page, because it's got a lot of information that you can learn about mental illnesses, and you can share with the individual who's looking for information. Another thing I want you to keep in mind is, and it's really important, that you post in your office the suicide prevention hotline. And that number is 800-273-TALK, 1-800-273-TALK. And it'd be really nice if you could post that in bathrooms. We find that's a good place to put, if you're thinking about suicide, call this number. When they call that number, they get linked up to mental health services in their community. So it's not like you're calling a national line and it's not going to get you hooked up with local services. So it's important to call that number and keep that handy and have people use that anytime they're in distress. If they come from a military background, they still call that number. And the nice thing is that it'll ask them if you're associated with the military or you're a veteran, they'll push 1, and then they'll talk to someone who really understands the military culture, which has its own very special problems and language. And so if someone's got a military background, encourage them to click 1, because instantly they're going to talk to someone who relates to the issues of the military. And the other thing is that every community has a crisis line, and the crisis line number, we call it the ACI, Access Crisis Intervention. That crisis line is available certainly if someone is contemplating suicide. But the other thing that the crisis line has is it has a full range of services for people who are simply having a mental health crisis. And you can call that line about an individual in your program and get advice on what to do, or you can have the individual call that number. That number is available through the Department of Mental Health's website. And let me just kind of look through our homepage here. If you have a crisis, someone needs to talk to someone through the Access Crisis Services, then click on Crisis Assistance up here in this corner, and that'll pull a drop-down map, and you'll look at the community that you're in, the county they're in, and that number will be available. So that's another number that I'd like you to put in big letters and post in your office and around your, if you need somebody to talk to and you're in crisis, call this number. So it's different around the state. It's not something I can tell you. You just kind of have to go on that map and find your own number. And so that crisis line is in there, so that's important. And then over here under mental illness, you can click here or down here where it says help with mental illness. If you click on that, you'll have another opportunity to look at your community, and you'll find out where your community mental health center is. So you'll click on the county, and then that community mental health center will pop up. And that's another number you want to keep. You don't need to worry about the numbers for the ones across the state. You just really need to worry about the one in your community. There's another little thing that I wanted to point out on this page, and this is the Mental Health First Aid course. And you could click on that, and you can learn about a program that the department has that we think is pretty interesting. It is a 12-hour course, kind of patterned after the Red Cross Basic First Aid, and it's a program for people, lay people like you and me that are not professional mental health people, and it helps us learn about the various mental illnesses, what it looks like and feels like to have those illnesses, ways that you can be helpful in linking people up to services, and also how to deal with someone who's in crisis. And so it's a terrific program. I would really encourage you to read up on it. And it might be something that the organization that you work for might want to find a trainer and bring it in and host that through your organization. We love it when people with mental illness attend too. They always add so much to the training. And then we do have some people with mental illness that teach mental health first aid. So it's a terrific program. It'll really enhance your understanding of this disorder, much more than we could cover in this little program. So anyway, I wanted you to know this website is just rich in information, and it'll help you find the resources you need for your community. And that's a good thing to know, because HUD asks you to build relationships with the resources that the people that live in your housing program might need. And so what do we mean by that? Well, I know for the Department of Mental Health and the services that we offer, it's pretty darn hard to get into them. And so let's say that you live in a community that is served by Agency Spring Hill Mental Health Center. And if you were you were calling from your program about Alice that you're worried about, and you call up and somebody answers the phone and they say Spring Hill Mental Health, and you say, well, I'm worried about a woman living in my program. Alice has been experiencing some symptoms and she's very uncomfortable and she wants some help. Well, the secretary that answers the phone will look, and she'll say, well, we can see Alice in 6 weeks. And you know that Alice is in a lot of distress right now and she really needs some help. If you do your homework or you do your relationship building before you come into that situation, you might have a better chance of getting Alice hooked up with her services. And this is how that'll work. If you build a relationship with a community mental health center, or you've got a mental health provider or substance abuse provider in your community, and they know you and you know them, then it's a little bit easier to get somebody in. And that happens because you've taken the time to learn the services they have. So you know that Alice's symptoms are serious enough that she would qualify for services. She's very distressed, or she's hallucinating, she's attempted suicide, or shared that she's considering it. Those things that indicate there's a serious mental illness. If you call up the person that you know over at Spring Hill Community Mental Health Center, then you've got a person that you can call personally. You've built a relationship so that that person knows that you're a professional. You're not going to call them unless it's a serious situation. And so that person at the Community Mental Health Center is going to work a little bit. She knows you're a professional. You've indicated this is a serious mental health problem. She may be able to get the person that you're concerned about filled in with a cancellation. You can work together about that. And then if you find out that you've got someone who maybe not experiencing really severe symptoms, but if you know the person that manages the local NAMI support groups, you can call them up and you say, I'm going to send my dear friend Alice, who lives in our housing program, to this meeting. Can you tuck her under your wing and make sure she's comfortable when she goes to the first meeting? And the lady at NAMI knows that you're a professional and that you wouldn't ask for this help if you didn't need it. And so she's going to do what she can to accommodate you. And on the other side, they're going to call somebody up and call you up and say, I've got somebody that needs some housing, and this is why they need housing. And you're going to reciprocate that respectful relationship and help them find housing. So it's just what happens in communities. It happens in communities all across Missouri and all across America, where people know people, and because they trust one another, they do a really good job of supporting one another. So that relationship building is really important, and you want to do it before you're in a jam. So show up at their tables. If they're hosting town hall meetings, go there and meet them. Just invite them to things that go on at your place so that everybody knows everybody. It just makes it work better, and everybody benefits, particularly the people we're trying to serve. So you want to follow through on that. So you've sent somebody over to NAMI, and your friend at NAMI took her, found a ride for the person, for Alice, and has taken Alice to the meeting, and she's made some friends, and she's learned some information, and she's got some numbers to call if she's in distress, and so it's all working out pretty well. But ask, make sure it is working. Maybe Alice isn't getting everything she needs from a NAMI, and maybe she does need to go to the community mental health center. Just check back and say, did that work for you? It's really important. Now, if you're not going to be able to call a community mental health center and say, you know, Alice was there, how did that go? Because they can't discuss anything with you because of the laws. But if you've got something you want to share with them, you certainly can do that. If you say, you could call up the counselor and just say, you know, Alice has been doing better since she's been seeing the counselor at the agency, or it doesn't seem to be working. I think she might need medication. You can do that. You can call up. They just can't talk to you about it. So, and if you build that relationship, then what you say is going to have a little extra weight. So it's good. Do it. If you have any questions, I want you to call me. Feel free to. Here's my information, and that is not my correct phone number. Oh, that's our main number. Sure. I'll give you my personal desk phone. That's 573-751-3220, or you can call this main number here, and you say the nature of your question, and they'll direct you to the person who has the answer. So I hope this has been helpful. I do welcome your comments, and we welcome your questions. And again, I want to thank you for the work you do. You're a big part of our treatment hopes and plans for the people that we serve, and housing is probably one of the key components of recovery. So thank you for what you do.